How zinc can improve your health. Zinc for your health. After iron, zinc is next. Very important mineral in our body. About 300 bioprocesses which are important for managing, maintaining, and running our body for day-to-day performance, are totally depending on the presence of this zinc. Zinc and health. Body do not produce or store zinc by its own. Body has to depend on food, what we eat. Its second most abundant trace material. After iron, present in every cell of our bodies. Its presence is most critical for our body growth, because it is needed for cell growth, cell division. It's responsible for the smooth function of our immune system, DNA synthesis, protein production, smell and taste senses of our body. Largely depends on the presence of this zinc. Zinc role in our body. Zinc is required for numerous bioprocesses going on in our body. Gene expression, enzymatic reactions, immune functions, protein synthesis, DNA synthesis, wound healing, growth and development. Zinc. Foods that do not naturally contain zinc. Breakfast cereals, snack bars, baking flour. Sometimes they are fortified by synthetic forms of zinc. Zinc deficiency symptoms. Although very severe zinc deficiencies is a very rare occurrence, it can occur in rare genetic disorders, breastfeeding infants, alcohol addicts, immune suppressing medications. It shows the symptoms, some of which are impaired growth and development, delayed sexual maturity, skin rashes, chronic diarrhea, impaired wound healing, behavioral issues. Zinc. Those who may be in the risk of zinc deficiencies. People with gastrointestinal disease, vegetarians and vegans, pregnant and breastfeeding, older infants, exclusive breastfeeding, people with sickle cell, people with anorexia, people with malnourished, people with chronic kidney disease, people with abuse alcohol. Lab test for zinc deficiencies are not that perfect. Doctor has to take his or her experience to decide about it. Zinc. Food source. Zinc is very widely distributed in plants and animal world, and it is easy to manage. Adequate amounts of zinc by food, shellfish, oysters, carp, mussels, lobster, and clams. Zinc. Food source. Meat, beef, pork, lamb, and bison, poultry, turkey, and chicken, fish, flounder, sardines, salmon, and sole. Zinc. Food source. Legumes, chickpeas, lentils, black beans, kidney beans, nuts and seeds, pumpkin, cashews, hemp seeds, dairy products, milk, yogurt, cheese. Zinc. Food source. Eggs, grains, oats, quinoa, brown rice, vegetables, mushrooms, kale, peas, asparagus, best greens. Zinc. Food source. Amounts. Maximum in oysters, followed by beef, carp, lobster, pork, beans. Further down, chicken, pumpkin seed, yogurt, cashew, chickpeas. Still further down, cheese, milk, beans. And then followed by fishes, flounder or sole. Zinc. Food source. Absorption. Although many grains and other plant-based food products are good source of zinc, but because phytates presents in them, interfere in the absorption process, and thus bioavailability of zinc from plant food becomes much lower than what we can get from animal and seafood. Zinc. Food source. Phytate effect. Phytates, phytic acid, these are naturally occurring substances, which are found in all types of plant food, like beans, grains, nuts, and seeds. There were concerns that they might interfere and reduce the absorption of minerals. However, a new studies indicates that so-called anti-nutrient effect of these phytates only occur when they are taken alone. But if someone take them with garlic, onion, etc., mineral absorbing enhancers, then these effects are not that significant. Zinc supplements. Now lot of zinc compounds are available as supplements. Zinc sulfate, it's claimed to be more useful in acne. Zinc acetate, it's often used in cold, in the form of lozenges. Zinc gluconate, it's most used one, also mostly for cold. Zinc citrate, less bitter, most good in taste, also better in absorption. Zinc orotate, most popular, and common. Zinc picolinate, claimed to be most better absorbed than all others. Zinc dosages of supplements. Recommended daily dosage of elemental zinc is 15 to 30 milligrams per day. For healthy adults, higher doses has to be given to health conditions such as acne, diarrhea, respiratory infections. Due to potential side effects are possible. Do not take more than 40 milligrams per day. Proper calculations has to be done to achieve proper elemental zinc in your supplements. Please read the label carefully. Zinc recommended dietary allowance for 6 months of age, both male and female, 2 milligrams per day. For 7 months to 3 years of age, both male and female, 3 milligrams per day. 4 to 8 years, both 5 milligrams per day. 9 to 13 years, both 8 milligrams per day. 14 to 50 years and above, in males, 11 milligrams per day. 14 to 18 years, females, 9 milligrams per day. In pregnant case it is 12 milligrams, and in the case of lactation it is 13 milligrams. 19 to 50 years and above, in females, 8 milligrams per day. In pregnant case it is 11 milligrams per day, and in the case of lactation it is 12 milligrams per day. Zinc tolerable upper limit for intake levels up to 6 months, both male and female. Child, it is 4 milligrams per day. From 6 months to 1 year, it is 5 milligrams. From 1 to 3 years it is 7 milligrams. From 4 to 8 years, it is 12 milligrams. From 9 to 13 years, it is 23 milligrams. From 14 to 18 years, it is 34 milligrams, also. Same for pregnant and lactating cases. From 19 to 50 and above, in all cases it is 40 milligrams per day. Zinc and coronavirus. Early research reports indicates that zinc has a major role in controlling the disease. It was told that most of patients were found to be deficient in zinc, and it was suggested that taking zinc alone or with vitamin C can provide some help, but there is a conflict in reports. Research data is not enough clear. At present we can only say it's not much helpful. Zinc Health benefits. Likely to be effective in diarrhea, it works. Reduces the duration and severity in children's, also giving zinc to women during pregnancy and 1 month after delivery. Can reduce the risk of diarrhea in infants for at least first year. Wilson disease, an inherited disorder that causes copper to build up in many organs. Zinc can help in this disease. Zinc. Health benefits. Possibly effective in acne, a skin disease. Zinc can help in this disease. Zinc oral is helpful, also a combination with erythromycin. As a cream is also helpful. Anorexia, a eating disorder. Zinc helps improve weight and depression symptoms. AMD, it's age-related vision loss. Zinc can slow down the disease. With antioxidant combinations, it is more effective. Acrodermatitis, it's disorder due to zinc deficiency. It works well. ADHD, it's attention deficit hyperactivity disorder. It works very well. Burns, zinc is very good in this. It heals wound fast. Colorectal adenoma, it's non-cancerous. Growth in large intestine and rectum. Zinc along with vitamins reduces the risk of tumor formation by 40%. Zinc. Health benefits. Possibly effective in common cold. Zinc gluconate seems to prevent cold in children's, but in adults it does not work. Depression, it improves the conditions to those persons who do not respond very well with antidepressants. Diabetics, it improves blood sugar, increase insulin levels, decrease cholesterol and other lipids. In type 2 diabetes, foot sore, in diabetes, zinc hyaluronic gel can help in foot ulcers and heal faster. Diaper rash, zinc help here. Both oral and cream can be helpful. Bad breath, chewing gum or candy containing zinc can help. Gingivitis, a gum disease. Zinc citrate with triclosan is helpful. Herpes, cold sores. Zinc sulfate or zinc oxide on skin seems to reduce severity of oral and genital herpes. Zinc. Health benefits. Possibly effective in hypereusia, a taste problem. It works in this case. Leishmania lesions, a parasite skin infection. Zinc can help in this case. Leprosy, a highly contagious disease. Effect on skin, mucous membranes, nerves. Zinc with anti-leprosy drugs can help in treatment. Muscle cramps, zinc can help in this case, particularly people with cirrhosis and zinc deficiency. Osteoporosis, a bone disease. Taking zinc supplements in combination with copper, manganese and calcium can decrease bone loss in women. Stomach ulcers, peptic ulcers. Zinc azoxanate seems to help in this disease. Zinc. Health benefits. Possibly effective in sore throat, in surgery. Zinc lozenge before surgery can prevent this. Pneumonia, zinc can prevent, but treating has conflict results. Preterm birth, zinc can reduce the risk for early delivery. Shigellosis, or infection from Shigella bacteria. It leads to blood diarrhea with pain. Disease mostly attacked to children 2 to 5 years of age. Zinc along with treatment can help in this disease. Sickle cell disease, a disease where red blood cells die early. Zinc can help in this case. Venous leg ulcer, a leg sore caused by weak blood circulation. Take zinc sulfate orally and apply zinc creams on ulcer. Wart, applying zinc creams can help in this case. Vitamin A deficiencies. Zinc along with vitamin A can help. Zinc. Safety and side effects. Most of the supplements are very safe and does not cause any much side effects. Some people do experienced nausea, vomiting, diarrhea, stomach pain, exceeding 40 mg per day can cause fever, headache, coughing, fatigue, exceeding over time can cause copper deficiencies. It can also reduce the effectiveness of antibiotics. Zinc. Safety, precautions, warning. Infants and children, care is needed. For proper dosages. Pregnancy, it is regarded safe. Breastfeeding, it's safe. Careful about dosage. Alcoholism, it create absorption problem. Diabetics, it can lower blood sugar. Proper monitoring is needed. Hemodialysis, it can create zinc deficiencies. More supplements may be needed. HIV, AIDS, use with lot of caution. Rheumatoid arthritis, they absorb less zinc. Malabsorption, they also absorb less zinc. Vegetarianism, they also absorb less zinc. Zinc. Interactions. When alone antibiotics, zinc may interfere and reduce effectiveness of these antibiotics. To avoid this interaction, take zinc supplements 1 hour after antibiotics taken. Antibiotics such as norfloxacin, ciprofloxacin, etc. Tetracycline antibiotics. Here also same effect. Take 2 hours before, or 4 hours after, cisplatin. In this case, zinc increases the efficiency of this anti-cancer drug. Penicillamine. In this case, zinc reduces the effectiveness. Amiloride, Midamor, a water pill. It interfere with zinc. Zinc. Interactions. Diuretics such as thiazide types. More specific, chlorthalidin and hydrochlorothiazide, found to increase urinary zinc excretion by 60%. These diuretics, in prolonged use, can lead to zinc deficiencies, so proper monitoring is very important. In this case, iron. Lot of people take iron. Iron does not allow zinc to get absorbed first, so more care should be taken. Copper. High intake of zinc can totally inhibit the absorption of copper, and this can lead to copper deficiencies. So again, more proper care should be taken. Disclaimer. Although care has been taken to ensure that the information presented here is very accurate and up to date, still, the channel takes no responsibility. Information provided here with respect to diseases and treatment are only possible indications. No way they will be taken as an alternative treatment, and they are not substituted for the advice provided by a doctor or any other qualified healthcare professionals.